In some cases, athletes are already back on the field.
Let's go!
And while it brings excitement, it also brings concerns over COVID-19 and another health issue that may be triggered by the virus, or could be a case where the virus worsens it.
Myocarditis is essentially a pathologic diagnosis of inflammation of the myocardium, or the heart.
A recent trend of myocarditis is something medical experts are keeping an eye on after some college football players tested positive for COVID-19. Then MRI scans of their chests showed signs of that condition.
And it has the potential to progress to scarring and fibrosis, which leads to heart failure and rhythm problems down the road.
One worry Dr. Dan Anderson with UNMC has are those who've had COVID-19 and have myocarditis and didn't even know they had the virus to begin with. So what does this mean for athletes? Dr. Ross Mathieson, who specializes in sports medicine at Nebraska Med, says it's a case-by-case basis.
And as long as the student athletes, as long as the coaches, parents, administrators, as long as they all know this, they can make that decision to go ahead and play if their risk tolerance is at that level.
If athletes test positive for the virus, they must pay attention to how they feel once they train or play again.
If there is a change in your exercise tolerance, if you're short of breath when you wouldn't have been short of breath before, if you're having abnormal chest pains, any of those sorts of things are red flags to go and get some more evaluation.
Anderson says in an optimal world, an athlete who tests positive for the virus should stop exercise for at least 90 days, which can put those who take the field or court in a tough position.
We often think it takes 90 days to heal and recover to the point where you're back to a new baseline. So that's a difficult window because that's, some would say that's almost the entire football season.
In Omaha, John Madden, 3 News Now.
Both doctors agree the best way to prevent it is to take steps to prevent yourself from getting COVID-19 by social distancing and wearing masks.